Hey guys, today I'm going to talk about menopause. It is a topic that, or a word that a lot of you all have heard about. There are also a lot of jokes about it, but let's be clear on what menopause actually means. A woman is said to have attained menopause when she has stopped getting her periods for about 12 months or 1 year. In India, the average age of menopause is about 46 years, which is almost 5 years younger than women in the Western countries, which is normally around 51 years of age. 5 to 7 years before actually attaining menopause, women are considered to be in the perimenopausal age group, in which they start to show few signs and symptoms which indicate that slowly they are going to attain menopause. So menopause basically occurs because your ovaries, their capacity of producing eggs has slowly decreased and has finally stopped. So once they stop producing eggs or follicles, they also stop releasing hormones such as estrogen, which stops the endometrium of your uterus from growing, and because of which there is nothing left to bleed out. Women suffer from a lot of symptoms, the most common one being a reduction or a decrease in their quantity and frequency of bleeding every month. They may start bleeding once in 2 months, once in 3 months, once in 4 months, and so on and so forth. Apart from this, they also very commonly suffer from hot flushes, which is basically a sudden increase in body temperature along with sweating and palpitations and an increase in pulse rate, which may last for about 20 minutes to half an hour and then go back to the normal temperature of the body. Apart from that, because of loss in estrogen and collagen, the skin starts to look and appear more wrinkly. There is loss of tone and shine in the skin. There is loss of fat, because of which suddenly the skin looks saggy, wrinkly and loose almost. And the muscles also lose their tone and elasticity and strength, which is why they may suffer from a lot of muscle weakness and muscular pain. Apart from this, women in the perimenopausal age group also suffer from loss of bone density, because estrogen is one of the main components which adds to bone density. Apart from this, women in the perimenopausal and menopausal age group are also at a higher risk of any heart conditions and any cardiovascular diseases, because estrogen also has a cardioprotective effect. So with the loss of estrogen, there are a lot of other signs and symptoms that women may suffer from. Apart from this, very commonly women suffer from a lot of vaginal dryness and painful intercourse, and they may also suffer from recurrent urinary tract infections, and sometimes even suffer from prolapse of their uterus because of the laxity of the muscles. Because genetics and heredity play a very important role in menopause. So if your mother and your sisters have attained an early menopause, there is a higher chance of you attaining menopause at an early age. But the signs and symptoms of menopause can be combated with a lot of lifestyle changes, some of which are including activity and physical exercise in your daily lifestyle, reduction in your caffeine intake, stopping smoking, and having a high protein and a high calcium diet. Apart from this, we tend to give women who are in the menopausal age groups calcium supplements, because to increase the strength in your bones and to prevent any bone injuries from occurring. Apart from this, women with severe hot flushes can also take vitamin E supplements, and of course, last but not the least, women with severe menopausal symptoms, we can always give them hormone replacement therapy, which is giving them supplements of estrogen and progesterone. In the menopausal age group, women should be going for yearly checkups for a normal pelvic examination. They should be doing monthly self-breast examinations, and every 6 months it's always best to visit your gynecologist so that she can do a head-to-toe examination, and also yearly do an ultrasound to know the status of your ovaries and your uterus. And every 3 years you have to continue doing pap smears until your previous 3 pap smear reports are negative or you've reached 65 years of age. make it a point to inform your mothers and your grandmothers or your aunts that once they've stopped bleeding, no amount of bleeding after a year is considered normal, and it needs to be evaluated because it could mean a bigger disease. So it's always better to get it checked. So there's absolutely nothing to stress about or try to postpone about your menopause, because it is such a natural condition and it is going to happen to each and every one of us eventually. So we might as well be more aware about it, learn how to incorporate those lifestyle changes from the beginning itself so that it's not such a drastic change that happens eventually, and take our supplements and keep visiting our gynecologists or our general physicians annually. That's it, guys. Bye.